Hello everyone. Myself, Dr. Tushar Bhatti. I'm an interventional cardiologist working in the Gokul Hospital, Rajkot. Today we will talk about angina pectoris. Actually, today is the World Heart Day. So 29 September is the World Heart Day, and for the World Heart Day, I want to give some message and some information for the public awareness. And today we will discuss about the angina. So, what is angina pectoris? Angina pectoris is because of the deficiency supply of the blood to the heart, and that also cause reduce the oxygen supply of the heart. So that will precipitate the angina pectoris. Now, what are the symptoms of angina pectoris? First of all, main most common symptoms of angina pectoris is chest pain. So most of the patient are presenting with chest pain, and that chest pain is like a central chest pain. It is like a squeezing and tightness of the chest, like pressing on the chest, and sometimes patient can feel heaviness of the chest. And most of the time, this type of symptoms occurs when patient exert, means whenever patient is walking or running or climbing the stair, that time patient may develop this type of chest pain. So this is the most important and most common symptoms of the angina pectoris. Other symptoms, if we see, like some patient have different presentation, like some patient present with only shortness of breath during exertion or during walking. Some patients are presenting with just fatigability, and some patient present with just tiredness. So these all are various symptoms of angina pectoris. Uh, why this angina pectoris can occur? So the main reason is we discussed, angina pectoris occurs because of the deficient blood supply to the heart muscle, or there is a, because of deficient blood supply, there is a reduced oxygen supply to the heart, and that's why this angina pectoris can occur. So the reason behind this is maybe some patients having blockage in the coronary artery disease, coronary arteries, like there is a obstruction in the coronary artery. There may be a thrombus formation which obstruct the coronary blood flow, that can cause angina pectoris. Sometimes some plaque rupture can produce angina pectoris, and sometimes microvascular dysfunction can also present with angina pectoris. Some microvasculature spasm can occur, and that can also cause angina pectoris. So next thing is, if this type of symptoms occurs, then what to do? So if a patient is having, if anyone is having angina pectoris, like chest pain or any of the above symptoms which I told, like shortness of breath, fatigability, uh, tiredness, that is particularly on exertion, like whenever patient is walking, climbing the stairs, like that time, if patient is having this type of symptoms, he has to or she has to contact the doctor first, and they have to evaluate for further, means is there any cardiac problem is there or not. And because this angina pectoris is because of heart problem or any other associated or precipitating factor that may leads to angina pectoris. So for that, patient has to consult the doctor, and he has to undergo some routine health checkup. Like for first of all, most important thing for cardiac checkup is ECG. So they have to undergo ECG, then 2D echo, which is the sonography, if we say sonography of the heart, to see whether there is any abnormality in the ejection fraction, means pumping capacity of the heart or not. Is there any valvular problem or not? Or is there any coronary artery disease is there or not? So this is the basic evaluation of the angina pectoris. And if anything is positive, means he has to go further investigation. Another thing is, patient has to control their other comorbidities also. Like if patient is having diabetes, hypertension, hyperlipidemia, So he has to control all these things also, because this thing is also associated with uh, macrovascular dysfunction, and that also leads to precipitate or aggravate the heart problem. So we have to control the diabetes as well as hypertension as well as our lipid level also. Then the thing is, if any patient is having angina pectoris, then what he has to do further? So he has to take regular medication for the angina, whatever doctor is prescribing. If patient is having typical angina, then he has to take some routine medications like antiplatelet drugs, statins, means to control the cholesterol level, some anti-anginal drugs like beta blocker, sometimes nitrates. And if still patient is having angina, they have to take another some drugs which can prevent the angina pectoris. So now we will discuss about the treatment of angina pectoris. So first of all, we have to underwent this basic routine evaluation. And if patient is having typical coronary artery disease, then he has to underwent angiography also to see whether this angina pectoris can be we can control by medical management only, or they need further angioplasty or any other bypass surgery like thing. That is depend on the angiography where we have to do the management. So if patient is having angina pectoris and patient has to take the medicines, then they have to regularly take the medicines and control all these risk factor. Apart from medications, patient also has to control the diet. Means there is a strict diet protocol is there. At least patient has to follow the routine dietary control. Then they have to also do the regular exercise, at least 45 minutes a day for 5 days a week. That is the regular exercise patient has to do to prevent the further progression of the heart disease. Then patient also has to do uh, control of their blood pressure, blood sugar level, and lipid level and cholesterol level. So this is the prevention for developing the heart disease. Another thing is, okay, for dietary control, we have to avoid that junk foods, which nowadays people are taking more. So that is the one more thing we have to take care. Another thing to prevent the heart disease, there is a some studies which says there is a if more stress is there, that also leads to development of the heart problem. So we have to control our stress by some routine meditation. And apart from that, if anybody is interested in some playing the games, so they can reduce the stress by playing the games or some extra reading everything. So this type of lifestyle modification, then regular intake of medicines and control of their blood pressure, sugar level and cholesterol level, this all thing can prevent the development of the heart disease and progression of the this angina. If despite all these things, if patient is having ongoing chest pain or ongoing angina, then depending on the coronary angiography report, they have to go further for treatment. Like if patient is having more coronary artery stenosis, means like stenosis is more than 70%, then they have to undergo either angioplasties or bypass surgeries according to need. So for this World Heart Day, I would like to message to the public, okay, please take care of your heart. Make your heart healthy so you can live healthy, and you can improve your quality of life, because most of the patient who is having heart disease, and if they are not taking care of their regular health, then they will develop more of the comorbidities, and they will have poor quality of the life. So for today's only one message, please take care of your heart. Thank you very much.